I'm Karen Pinder. I'm the sister in the Medical Physics Department at University Hospital North Durham. It's called a Myocardial Perfusion Scan, or some people call it an adenosine stress test. It's for people that they think may have angina. Read your letter properly. You've got your time and your date on there. There's 2 times on your first appointment. Come for the first time on your letter, because that is when you're going to get the drugs to label your heart so we can see it on the heart scanner, and the second time that's on there is your scan time. Your whole appointment for your first visit will be approximately 2 hours. The scan itself takes about 15-20 minutes. If you've got any mobility problems that we might not be aware of, any back problems, things like that, that you maybe haven't been to the hospital for, but it irritates you and things, if you let us know that, even if it's on the day, because the position you're going to be in for your scan is on your tummy with your arms above your head, we can change that around a little bit, but if we know about it beforehand, we're prepared. Before you come to us, there's some important information that you need to know. 24 hours before your appointment, you need to stop everything with caffeine in, because if you do have caffeine, it will affect the test and we can't do the test, so the test will be cancelled. So no coffee, no tea, no decaffeinated tea or coffee, because even though it hasn't got the caffeine in, the substitute still goes to the same receptors that we need to get our drug to. No chocolate, because chocolate is full of caffeine and not a lot of people realise that. You need to drink milk or water, and that's it for a full 24 hours. You can eat as normal, as long as things haven't got chocolate in, things haven't got caffeine in, things like that. You need to ring us and tell us what medication you've been put on. If it's antibiotics for a chest infection, something like that, we will postpone your appointment, because we can't do it if you're unwell. Any medication the doctor has given you is absolutely fine, because that won't contain caffeine. Anything you buy over the counter, such as paracetamol extra, Lemsip, things like that, the majority of them have caffeine in. So we'd rather, if you had a problem, give us a ring just to double check those things, or read the side of the box and it'll tell you if there's caffeine in. We're usually informed about people with asthma beforehand, so if you give us a ring, we'll advise you accordingly. We do this test on asthmatics, but unless they're severe asthmatics, we can use our normal protocol. If you have got really severe asthma or uncontrolled asthma, we give you a different drug and get a doctor over just to sit in with you while we're doing the procedure. 4 hours before your appointment, you shouldn't have anything to eat unless you're diabetic. If you're diabetic, it is wise to give us a ring beforehand, but you can have a light breakfast, toast, cereal, something like that. But again, no tea and coffee. There's a second day and time written on the bottom of the letter. That is for the resting part of your test. The first part of your test is where we make your heart do a bit of work, and the second part of the test, which is the handwritten part, is where we look at your heart while it's relaxed, while it's resting, and we're basically going to give you some radioactivity to label the heart on that day, and then do your scan. Very similar to your first appointment, but we're not going to make your heart do that little bit of extra work, and we're going to compare the 2 sets of images and see what the difference is. We get those results reported on within a couple of days, so they are put on the system pretty quickly. Your consultant will decide when he wants to see you. What we normally say is it takes sort of 3 weeks-ish. If you haven't heard anything by then, give the consultant secretary a ring.